Hello, everyone. Hello, hello. Welcome. You are in the right place. This is Living Sickle Smart with Ray Blaylark and Sickle Cell Foundation of Minnesota. If those of you who have been here before, welcome back. Those of you who this is your first time, we're so glad you joined us. This is our first Sickle Smart session of the new year, and I couldn't be happier to have our guest. But first, let's make sure that we want to say thank you to our partners and our sponsors. We have Dr. Tomia Austin with us today with the As One Foundation, Beam Therapeutics, as well as Memorial Blood Centers, and the Sickle Cell Disease Data Collection Project right here in Minnesota. So without further ado, today's special guest is Dr. Tomia Austin, just as I said, and let me make sure that we can see her. She is the executive director of the As One Foundation. It is Kidney Awareness. It's Kidney Health Awareness Month, and we are talking about kidney health for sickle cell trait warriors. So without further ado, I want to introduce Dr. Tomia Austin to you, and we're going to get this show started. By the way, everybody, we do these shows live, so that sometimes there's technical issues, sometimes there's challenges, but we keep going. All right. At the end, we will address all of your questions. So we encourage you to put your questions in the Q&A box because this is interactive. We want to have a conversation as well. So without further ado, Dr. Austin, you are muted.
I just want to hope that I match your energy. Thank you so much for this opportunity. I don't take it for granted. This is definitely my passion area, but to have the opportunity to share this platform with you means everything to me in my quest to not have a job, to not need to do this, because universally everyone knows what sickle cell is, what sickle cell trait is. Our doctors are well versed, and our patients and caregivers and their families are living their best lives with the best quality of life. That is the vision, that is the goal. But in the interim, we are here, and we certainly appreciate the audience tonight. So I am going to jump right in and wish everyone a happy Kidney Awareness Month. Happy Women's History Month. Tomorrow is World Kidney Cancer Day. I believe I got that right, but let me share my screen so we can get started. And I need to do it's blocking my view. How do I do this? My computer, my Mac died, so I'm this little bar at the top is hiding my stuff, so I can't see how to make it full.
I can definitely see your slides. You are sharing them.
Okay, is it full?
It's
screen?
Not full.
Okay, that's what I'm looking for. And
you're almost there. Your little cursor was almost there. And you're on a Mac. I know nothing about
I'm not on a Mac. That's the problem. If I were on a Mac, okay, I'm gonna stop sharing just because the little bar at the top.
If you go to the bottom, down at the bottom where you can change the size of your screen. Yep, right there. Click that.
Yay, I think it did it. Yes. It's big on my screen. So is it big for you?
No, click share screen, the green button down at the bottom.
Okay, I'm sharing. It says I'm sharing.
Yep, I want you to, but I'm going to have you choose a different window.
Okay.
So
stop sharing.
Yeah. Well, you did. Okay. Reopen share screen.
Okay.
And then be sure to click the one that's in full screen.
Okay.
For your presentation.
Got it.
Otherwise,
did that do it?
Let's see. You got it.
Yay. Okay.
Let's hear about kidney health.
And my senior moment. But anyway, okay, yes, we are here to discuss kidney health for sickle cell trait warriors. And how do you advance on okay, there's an arrow right there. Okay, I went too far just to say I have no disclosures, but I am here representing the As One Foundation, where our mission is to empower families globally, delivering life-saving sickle cell education. Just celebrated my 13th anniversary with the As One Foundation on the 1st of March. And our story, our origin story is what we're talking about today. Sickle cell trait took the life of a young man who was born in Nassau, Bahamas with his identical twin brother. Their parents didn't know there were twins coming until they were born. Throughout the pregnancy, they had been hearing two hearts beating as one. So fast forward, they make it to the United States after their parents divorce. They come as toddlers, they get nationally recruited as high schoolers and make it a checkoff on their list of dreams and goals to Florida State University, play as true freshmen, and won every game but the championship that year, and came back that spring, February 26, 2001 to be exact. They had completed the majority of the drills that they were required to do that day, those conditioning workout drills, where they were coached that your body is amazing, you'll pass out before you die. Water was kicked out of practice, out of the conditioning workouts, and Devon passed out, was being carried through the drills, and ultimately his body and the sickle cell trait living in his body was no match for the exertion and dehydration and exhaustion that he was enduring. And that day became a pivotal day and is the tragedy that turned into the triumph that is the As One Foundation, because we certainly believe that our education is preventing the type of death that Devon suffered. And we hope with every life we touch that Devon's spirit lives and his memory never dies. But we are, and because of that, we talk about sickle cell trait. I know this audience is likely very aware of that sickle cell trait is not disease, and believe it or not, everybody don't know that. Sickle cell trait is not the same as sickle cell disease. It is definitely the most common genetic blood disorder, and it is a natural selection thing that occurred to protect us from malaria, and it only requires one parent to provide us that genetic identity, 50% of their genetic identity, to pass it along to their child. I'd like to dedicate this presentation today to Ronnie Hillman, who died in December of 2022 after being diagnosed in August of 2022 with RMC, which we will talk about more today. It is the renal medullary carcinoma, or the kidney cancer that can affect those living with sickle cell trait. Ronnie is a Super Bowl winning running back for the Denver Broncos, did a lot in the community, and just look at that smile. I believe he was a young 31 years old, if I have my math correct. So why does this matter? Why do we have this conversation? And as we said, it's the most common genetic disorder. This is a condition that affects people of African, Asian, Indian, Latin, Italian, Irish, Greek, Turkish, Mediterranean descent. It literally can be in anyone. It is not a Black thing. It can be an anyone thing. This is important. That's why it matters. We like to say this is a bloodline thing. This is not a skin color thing. So we encourage you to know your status and don't eliminate yourself because of your racial background, your ethnicity. Everyone should be tested for sickle cell trait. And that testing will also help to address the myths. And some of the myths, this is not all of them, but some of the myths are that sickle cell trait is benign. It affects only African Americans. It's nothing to worry about. And when it comes to athletes, their attitude about testing is stigmatizing. And there is research that contrasts all of these myths. And then Merriam-Webster defines benign as mild type, does not threaten life or health, not cancerous, and asymptomatic, not causing, marked by, or presenting with signs or symptoms of infection, illness, or disease. These are the two main words that are often used to describe sickle cell trait. However, there are emerging bodies of the body of research is growing when it comes to the correlation of sickle cell trait complications from chronic fatigue, which is the most spoken about, but probably the most overlooked. Splenic infarction, pneumococcal disease, blood clots, venous thromboembolism, retinopathy. What we're here to talk about today: kidney injury, kidney cancer, renal medullary carcinoma, even acute chest syndrome, AVN, avascular necrosis, exertional sickling or ECAS, sudden death, and even COVID-19. And I quote, I won't read everything, but I will just say that these researchers have determined that sickle cell trait and these complications associated is important enough for physicians to be aware of these associations. And I could go on and on and on and on and on. And I know the patient population can go on and on and on. I've spoken with plenty of parents who have had negative experiences with physicians who are undereducated about sickle cell trait, but have caused our patients to feel that their children are just making things up or seeking attention because it's not sickle cell trait. Sickle cell trait is benign. Sickle cell trait is asymptomatic. But it's right here in this research. It is important enough for physicians to be aware of these associations. And that is what my goal is today. I am not a clinician. I am not a physician. I am a researcher. So I am not providing medical advice. You're right, and you are admonished by me to seek advice from your physician and take that power and be empowered to do that. But feel free to share this information that I'm sharing with you, because I am all about empowering you with to be able to make informed decisions about your health and the health of your loved ones. Kidney health and the sickle cell trait warrior. March is National Kidney Month. March 9th is World Kidney Day. Green is used to bring awareness to kidney disease, and orange is used to bring awareness to kidney cancer. Orange and green are two very significant colors to me for so many reasons. And if you know, you know, as the young folks say. Get back to this arrow. Now, some general risk of kidneys are chronic kidney disease, or CKD, which is the gradual loss of kidney function. But in particular for sickle cell trait, there's increased risk of CKD. End-stage renal disease is another general complication associated with kidneys. And again, it's a twofold increased risk for those living with sickle cell trait. And then there are kidney complications specific to sickle cell trait. And I have included at least one resource in the literature to back these up, but you are please screenshot this and fact check me. But I want everyone to know. I want our trait warriors to know and not feel that you're crazy or something is wrong with you. This is in the research. So that means that others have presented and enough for researchers to capture it. Hyposturia, inability to concentrate urine, or bedwetting. I've even heard adult bedwetting. And this kind of harkens back to that whole growing pains description when it comes to pain in sickle cell trait warriors. If you're 40 years old and you're still having growing pains, it's not growing pains anymore. It's something worthy to be checked out with your physician. Hematuria, blood in the urine, which could be vast. It can be a sign of many things, but it is associated with sickle cell trait in the literature. And I've spoken with several trait warriors who have dealt with blood in the urine. And this is of particular importance because of what it can be an indicator of. Rhabdomyolysis, rhabdo for short, is something that can affect anyone who is exerting or overexerting, but certainly with sickle cell trait, people living with sickle cell trait can be, it can result in hospitalization, and also it can be fatal. This is working the muscles so hard that they fail, and in that failing, the tissue breaks down, and that breaking down of the tissue, the body is still trying to function, and in that functioning, is trying to process the breakdown of that muscular tissue through your kidney, and your kidney cannot do it. And a sign, of course, is very, 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 very dark urine. And of course, the inability to use those muscles, which is often resulting in hospitalization. Those living with normal hemoglobin often recover, but it is a much longer process for those living with sickle cell trait. And this is one of the terminologies that was used on Devon's death certificate, because as we are aware, until I'm aware differently, sickle cell trait is not listed as a cause of death code. So his death certificate lists exertion, exhaustion, rhabdo, dehydration as the cause of death complicated by sickle cell trait. And then renal medullary carcinoma, RMC for short, is a rare and fatal kidney cancer. And I would like to just be victorious in saying often fatal, because there is continued work that's being done, clinical trials, research, therapies that are in trial that are causing surviving of RMC. But as in the case of Ronnie, who we are dedicating this presentation to, he was diagnosed in August and he had passed by December. It is usually a very short diagnosis because renal medullary carcinoma is usually diagnosed late stage. If it can be, and it can be, but if it is diagnosed early, I am aware now of multiple instances where an early diagnosis occurred, and the tumor on the kidney was able to be removed, and the individuals are living and thriving. In particular, there was a young child, I believe 18 months old, that was having difficulty walking or was not walking. There was a delay in walking. So running, routine tests, looking for, whatever could solve the mystery of why this 18-month-old was not walking, a small tumor was discovered, and that tumor was removed. And I believe that baby is now in their teens, living and thriving with sickle cell trait. So it is survivable if it is diagnosed early. And that's what we'd like to see. And as far as we know, that requires early imaging of your kidneys early and often. And I'm thinking sickle cell trait people should, have their kidneys, images of their kidneys annually to, avoid the possibility of a late stage diagnosis. Now, what makes this more clear is, or what backs up my reasoning behind this, is the exertional sickling part of this. There is more or emerging research that is correlating sickle cell trait, yes, to RMC, but also sickle cell trait and exertion leading to RMC. So this part of the mission of the As-One Foundation, which targets young people that exert, is why this is so important for us in our education and sharing this education with you, to bring awareness, of course, to Devon and what happened to him and so many other athletes, so many other young athletes, and hopefully those that live like his identical twin brother, who went on to a national football career and continues to remain active and exert regularly when it comes to his working out and all of that, can take precautions, and we'll address some of those precautions to avoid the possibility of complications. Very simply, this is the research linking SET to exertion and kidney injury is high intensity exercise, identifies high intensity exercise as a risk factor for RMC in individuals with sickle cell trait. And here I just wanted to demonstrate that I'm not talking about, taking a brisk walk. And even in Devon's case, it was not the game. It was not even practice. It was the long, drawn out 45 minutes, an hour of pure exertion. No warm up, no hydration, no recovery. You got to change and go to the next thing, change and go to the next thing. And they refer to it as being gassed, just completely just out of it. That is the point of exertion. And young athletes know, current and professional athletes know this level of exertion, which is an absolute danger zone for people living with sickle cell trait. And now research is linking that type of exertion to also RMC. The background of all of this, the NCAA mandate, we now have screening. We do have testing for NCAA athletes, but unfortunately, we still have deaths. And that is why this opportunity to present to you today is so important. Education is key because the young athletes need to know, their coaches need to know, the majority of the trainers know, but I often like to just illustrate that in these larger programs, these winning programs, these high dollar programs, winning is key and the coach is God. So if an athletic trainer is overruled and told kick the water out, the water's getting kicked out. And another thing, the culture of it is the young athletes are wanting to be pushed that hard. They want to go through the wall. So it is a tall, steep hill to climb when it comes to combating the culture that is associated. But this is why our parents, our caregivers, and our audience today is so important, so that each one can teach one, and and so on, to offer this life-saving education. We offer that when it comes to kidney health, or when it comes to general health, there are just a few protective factors that all of us can use, but that have definitely proven to be protective for those living with sickle cell trait. And that is because of the risk factors that are illustrated here: dehydration, elevation, and that is, what happens in Denver with Ryan Clark when, the higher elevation, but it can also happen in deep sea diving and lower elevation. It's a threat to your oxygen. And the whole point of the fact that people living with sickle cell trait have sickle cells that take longer to regenerate than normal blood cells. So they need that time, and any threat to that even slows that process down even more. And then, of course, the exertion and the renal medullary carcinoma are risk factors associated with sickle cell trait. And this is collegiate athletes. Sickle cell trait has already been classified as the top killer, the top non-injury killer of collegiate athletes is sickle cell trait, because of all of these risk factors that we have just demonstrated. And this is just to show you a few of the beautiful faces that have been lost to sickle cell trait associated deaths. And these are also high schoolers. So it is not, prejudiced to just pro athletes or collegiate athletes. It has taken our babies. And we can do something about it. I personally believe that these exertional deaths associated with sickle cell trait are 100% preventable. And here we speak about one of the protective factors. When we, give our pets water, we're wanting to prevent them from being lethargic. We put water in our cars to keep them from running hot. We water our plants to keep them alive and blooming and thriving. And this picture up at the top left, I actually took this picture during my dissertation research in Tallahassee, Florida, at a local school, observing young people, at a local park, working out. And just before this moment, they had been running and, really exerting. And I observed I observed no water, no kegs, no coolers, no water bottles. And not to say that it wasn't, somewhere, but it needs to be, because in order for humans to avoid dehydration, we have to consume half our body weight in ounces of water per day. And the consumption should be before, during, and after physical exertion. So water should be nearby, because what we are not encouraging is that you go and drink a gallon of water in one sitting. It is possible to drown yourself that way. And that's just not the healthiest way to get your consumption of water. In other words, the protective factors that were not available or were not allowed in Devon's practice conditioning workout that day, he was not allowed to go from, sedentary to intensity gradually. They went in there and just started hitting it. He was not allowed hydration. It was kicked out. And they switched from one drill to the next drill to the next drill with no recovery in between. This said in the simplest way is warm up, drink up, rest up. Warm up, go from rest to exertion gradually. Drink up before, during, and after, half your body weight in ounces of water per day. And rest up, you have to be allowed to take a knee, put your hands on your hips, raise your arms above your head to expand your lungs. All of these things are protective factors that we believe not only are beneficial to all of us, but certainly those living with sickle cell trait that exert or just are needing to have healthy, taking care of their kidneys by hydrating regularly, processing the chemicals that we put into our bodies that our body doesn't even recognize, processing sugar and other things, rinsing it out, good blood flow. There are many, 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 many benefits of hydration, and proper hydration is what we've said, consuming half your body weight in ounces of water per day. This is teachable. Your kids can say it. You can remember it. Tell your coaches, warm up, drink up, rest up. My child with sickle cell trait needs to warm up, drink up, rest up, and tell them to see the As One Foundation for backup. And this is, again, all of us need this, but we all have a role to play. Even if you are not, in some descriptions, some people, I've heard them describe themselves as blessed to be sickle cell warriors. They wouldn't, they wouldn't change a thing. However you choose to look at it, you still have a role to play, and we welcome you to join in as an ally, knowing what your genotype is, versing yourself with this information so that you can share it and possibly help us save a life. It is March, it is Women's History Month, but so I just wanted to share women in sickle cell trait to know, starting with Miss Richie on the top left. Richie Johnson is the founder. She is an RN and founder of the Chris C.J. Johnson Foundation, who lost her son, who was a football athlete, to RMC. And at the time, as a practicing nurse, she had no idea that there could be complications associated with sickle cell trait, but she has now dedicated her life, number one, to establishing the foundation. Chris C.J. Johnson Foundation is actually celebrating with their Keeping It Renal 5K later this month. So please look her up, Google her, and support, because the funds that she raises, she dedicates, she actually contributes to research and is very intimately involved with MD Anderson in the clinical trial. She has a support group for RMC patients and talks extensively and expertly about kidney health and RMC in particular. To her right, just to the right of Ms. Ritchie on the screen, is Dr. Maisha Pasante, who is an MD, also known as the sickle cell trait doctor, or the trait doctor for short, Her organization, Inscription, is a consultancy that will consult trait warriors all over the United States. And I believe outside of the United States, she has definitely presented with us, the As One Foundation, during our trait track with the Warriors Convention and several other platforms to spread the gospel that is sickle cell trait education. And she, as an MD, gives a very detailed talk about the clinical implications of kidney health and why she can answer, and is a brilliant doctor to explain the details associated. Just below Miss Ritchie and Dr. Pasante is Journey, and she's being kissed by her mom and dad. Her mom, Camille Butler, who started Journey to Happiness. Their daughter, Journey, was a young sickle cell trait warrior, and Journey was a whole life in herself. She was just so full of life, a dancer, performer, and RMC took her too soon, and Camille and her family started Journey to Happiness with the purpose of educating, because she also had no idea that sickle cell trait had complications associated, and just really wishes that she had known more. But Journey, her life lives on through her telling of her story and sharing it. And I certainly wanted to take the time to honor the memory of Journey and Camille thriving and surviving with her husband and remaining children. The bottom left is Anna Maldonado, who is also an MD, a general practitioner, I believe. She is a trait warrior, and she is surviving RMC. We had the pleasure of Dr. Maldonado joining us at the 2022 trait track of the Warriors Convention, and we certainly hope she'll be back to join us again. She is living the story of RMC, and she will say to you that sickle cell trait is not benign. Sickle cell trait is not asymptomatic. She was a runner, and she would push herself beyond the limits that she knew, and attributes that to the RMC. So honoring, and Dr. Maldonado is still with us and fighting, but she will tell you, take care of yourself, warm up, drink up, rest up, hydrate, rest, protect your peace, all of these things that contribute to our health or not so good health. And then finally, the late Miss Wendy Ann Darling, who we lost on January 26, 2020. She is also a trait warrior. She is the mother of the As One Foundation, because she birthed our inspiration in Devon Darling and our current founder and president of our board, Devard Darling. Miss Wendy is now our angel, and certainly everything that we do at the As One Foundation is dedicated to her memory as well. And this is just a few. There are so many wonderful women in sickle cell trait to know, but I just wanted to take the time to make a tribute to them, to Ray Blaylark for this opportunity. Thank you so much. These are my slides, so I will, the end of my slides, so I will stop sharing here and welcome any questions.
So first and foremost, thank you. We have had tons of conversations about the fact that there's not enough conversation happening around sickle cell trait, and the importance of people getting the word out, not so that they can be panicked, not so that they have to live in fear, but because knowledge is power. I love what you said about making sure that there's that early diagnosis. First and foremost, I'm encouraged, because there was a time that there were no stories of people who were surviving RMC. Mm-hmm. And the fact that people are surviving it is likely attributed to paying attention to your body and actually having a physician who's listening to you while you advocate for your health. And those two pieces are so very important, but they're also pieces that we struggle with as people of color when we advocate for ourselves, being heard, right? We know that health inequities and inequities in outcomes are oftentimes attributed to communities that are being underserved, and are not necessarily listened to when we go to the doctor. So it is so important that we empower people so that they can speak up on their own behalf, so that we tell them, here are some things that you should be looking out for. It may not be everything. Pay attention to your body. Talk to your physician when something's going on that you don't have an explanation of, or that doesn't feel right to you. Don't ignore your body. It's so important. So yeah. I so thank you for that. Like I told you all, if you have any questions, you can put them in the chat, in the Q&A. And I do have a question. Fantastic. Someone would like to know what type of health screening is in place for RMC. So you had mentioned about annual screenings. And can you say anything more about what those screenings are?
Oh, I'm going to say a lot more, because there is not a standard at the moment. Ideally, dreaming, manifesting, I would like it to be a standard that if you have sickle cell trait, that your kidneys are automatically ultrasound. You have great clear imaging on an annual basis. It's the only way to get an earlier diagnosis. Now, that manifestation is met with criticism. We've been told that would overwhelm the medical system, or that's it's inciting too much fear, or all of that. I don't have an answer for that part. I am very much so appreciative of the fact that now we also have this correlation of exertion and sickle cell trait, which could leave those that lead a sedentary lifestyle, are not athletes, with less worry. Because like you said, we're not trying to incite people and, give them worries for no reason. But Black people of African descent, are so overrepresented in so many health disparities. I don't care about us overwhelming the medical system. We're people and we need to be tended to. That's and every research paper that I've ever read, they all conclude with more research is needed. And the research about just general chronic kidney disease, general end-stage renal disease, and of course, sickle cell, people of African descent are overrepresented. So let's over-test.
Well, I agree. And that's one of the arguments that I have, is that when we look at many of the disparities, particularly the health disparities, there's more conversation than there used to be about addressing those issues, and they are multifactorial. There are many different reasons, but one of the concerns of mine is that if we as a population, the Black and brown people, are seen as carrying more health concerns, then why isn't the healthcare system more attentive to our needs? One of the reasons for the disparities is the lack of attentiveness, as I said before, the lack of being believed, the lack of insurance, all of these other disparities that impact it. But I've been in situations, even for my own health, or even my son who has sickle cell, where you don't feel like you're being heard, or they're very dismissive, or I've even heard, that's nothing to worry about. If I walk in a healthcare system and I'm worried and I'm concerned, then I would like us to pay attention to it, or at least tell me a why. Why shouldn't I be worried? Help me to better understand. So, part of that advocacy is pushing the system, not in a negative way, not in an unprofessional way.
Sure.
It's saying, I am aware that there are health disparities. I'm aware that our life expectancy is different than other groups. I want to make sure that I'm doing my part to ensure my survival, the survival of my children, the survival of my family members. I know my family is tired of me, because I'm like, well, ask that doctor why they said that.
Yes.
If we're not asking the why, they're not always offering it to us. And more than not, they just don't.
And if I can interject there, our doctors they are undereducated. So
Yes.
all of them are not ill-intentioned.
Yeah.
You know, all of them are not combative for no reason. They don't know, and they don't know what they don't know.
I agree.
So our patients are often having to educate and advocate while seeking care. So again, multifactorial, but when it comes to this kidney cancer, they have to have great imaging of your kidney. That's just the only way.
Yeah.
By the time the blood is in the urine, by the time you're having lower flank pain, it's likely too late. But again, lower flank pain can mean other things too. So
which is low back pain.
Yeah, yes.
So just for those who may not know, lower flank pain, that low back pain, which can be associated with so many things, right?
Yes, yes.
And so just don't take it lightly. We should be told at a young age, if there's blood in your urine, don't dismiss it. Let me know as your physician, or all of those conversations that we have to have. But guess what? If they're not having them in the clinic setting, we're going to have them in the community setting. And we're going to make sure that we arm patients to go in and feel like that they are empowered to speak up, ask questions. If you need to bring an article that's been written and bring that with you in a folder, and ask your physician to take a look at that. I think that's part of what advocacy looks like. And I appreciate that you called out that that physicians are undereducated, because we have to address the fact that there's a lack of research. The research needs to be done so that we can ensure they are properly educated. And I think that the more that we have these conversations, the more that we ask questions, the more that people, address the stigma that's associated with having any kind of a diagnosis or illness, right? Nobody wants to feel like that they are being judged for complaining about things going on in their body or bringing it up in a conversation. So we have to address that stigma. You kind of talked a little bit on my next question, and that is about the screening. So is there blood work, or is it actual imaging scans of the kidneys that is necessary in order to see any kind of abnormalities?
Is, as far as I know, and I am not a clinician, it is imaging.
Okay.
Close, sensitive imaging is required.
Okay.
In the cases that I'm aware of, it is ultrasound.
Yeah.
It is ultrasound.
Yeah. And because more research is needed, it's really hard to say what else might be associated with sickle cell trait. So there's a question about, is there any known link between sickle cell trait and autoimmune disease? We can't say. And the fact that we can't say is the urgency, right? We have to be, that we know if what happens to my son with a body full of sickled cells wreaks havoc on him, what is happening to bodies that are maybe not full of sickled cells, but still have sickled cells floating around? We have to know that creates some challenge, because our bodies are not created to just carry sickled cells. Right. We know that they don't carry oxygen. We know that it causes damage to the organs. So we know that even in a less intense way, the fact that they're still in our bodies means that there could be damage that's being done. So I really appreciate that. I also love that we're talking about benign, because there's still states who do not tell you if your baby that you just birthed has sickle cell trait.
Yes.
The same test that tells them if they have sickle cell disease, I'm gonna put this out there, the same test that identifies sickle cell disease when they're babies during newborn screening also identifies sickle cell trait. So we need to advocate for sharing that information, because it's not benign and there is something you can do about it. And every parent should be informed so that they can educate their child in age appropriate ways, of course, as they get older, that they're also in the highest risk category for having a child with sickle cell disease. Yes.
And that is like the ding, ding, ding for me. I countless couples have said to me, look, I love my kid and I'm glad they're here, but we didn't find out we had sickle cell trait until our kid was born with sickle cell
Right.
disease. And at least I could have been prepared to
Right.
know the possibility, to know that I roll the dice with each birth, that family planning, the Punnett square, to understand, okay, what is going on in my blood and what is going on in your blood. Okay, so we're going to give half of this to our kid. So let us know what this is that we're going to be choosing to do, but to have made a choice that they didn't know they were choosing.
It's about making an informed decision.
Absolutely.
And if you don't have all the information,
absolutely,
you can't make an informed decision.
Exactly.
And you're right. That's every family is going to make the choices that are right for them, but we all have a right to be knowledgeable. And I always say, if knowledge is power, the absence of knowledge is oppression. And that is how we stay oppressed, by not being educated, not being informed, not knowing what we don't know. So that's one of the reasons I do the SickleSMART show. We have to have these broader conversations than what happens in a 5-minute appointment. And so if we can unpack some of these things and have these conversations, give people a safe space to say, I'm trying to talk to my doctor about this and I'm not being heard. I will honestly say, if you have a physician who doesn't want to hear your concerns, that physician may not be a good fit. I don't know your situation, so I'm not giving any kind of advice. Don't say Ray, the lady in Minnesota, because what I'm saying is always make sure that your medical team, that it feels like a good fit, that you matter, your voice is heard, that you are visible, and that you're not dismissed, when you're talking about things like this.
And it's a progression. We have newborn screening here in the United States, but just like you said, every state is still not informing. And even though we have newborn screening, we also have a large immigrant population who was not a part of our newborn screening. So the progression is we have something good, but it can be improved. And, we have all of these good things in America, but it's not, we also have progressions in every other aspect. So things need to continue to evolve and continue to improve. And, we need more research. We need more funding to afford more research. We need more community health workers. We need more educators. We need more, well funded CBOs to be in the trenches. It is a progression. We don't arrive at a destination with sickle cell trait or with sickle cell disease. It is a constant evolution. We got to get everyone aware. And not just a bulleted letter that says you have sickle cell trait, it's nothing to worry about, just don't take the risk of procreating with someone. No explanation, no education.
That's right.
We had to follow up. But I know our CBOs, if it's anything like my experience at leading a CBO, we do so much with so little. So we got to be funded. Our good serving servant leaders need compensation. So
I agree. And then, that's one of the reasons that we as an organization began to advocate and work with our Department of Health, because we needed them to right the wrong. And the right, what they did right is added sickle cell disease to the newborn screening. What was overlooked was the need to educate a community about the disease. And in educating about the disease, you can't help but educate about trait, right? And then as that conversation increases, then we can talk about the research that's needed as well. And so this is part of advocacy, but we also want people to understand the values that they bring to the sickle cell community, because for far too long, sickle cell community-based organizations are only talking to people who are impacted by sickle cell disease. We want people with sickle cell trait to understand that they are part of the sickle cell community. It's not sickle cell disease community, it's sickle cell community. That means whether you have disease, whether you have trait, whether you love someone with sickle cell disease or trait, whether you've lost someone with disease or trait, you are part of our community. You are our village. And I think that as we increase our village, we will increase the impact that we are having. And we spread the education and understanding even further than we would before. So this is also empowering people who do have trait to understand, come on in to our house,
Yeah.
right? No, you may not feel like you are heard. You may not feel like anyone can relate to what you're talking about, but we can over here in the sickle cell community, and you are one of us. So I think it is important. In Minnesota, we do now have sickle cell trait notification program, which is wonderful, but we didn't get that until 2015. 2015. But if we added, one of the things that I tell them all the time, and I say it in many presentations, is in Minnesota, we added sickle cell disease to the newborn screening in 1988. That means for 30 years, we have not been talking about who can have children with sickle cell disease.
That part, as the young folks say.
Exactly. So I say that an undereducated community is a miseducated community.
Absolutely.
And so we've been miseducated, misled to believe nothing to worry about here, nothing to see here. And maybe it's not. But if even we don't know who those rare individuals are who will be affected. I don't know if that could be me. I don't know if that could be a loved one in my family, because sickle cell trait runs in my family. We want to make sure that we are not undereducated. I'd rather people be overeducated.
Amen. And again, I'm not a clinician, but I have read and have been told that the electrophoresis, the very sensitive sickle cell testing that will give you your genotype and your percentage of abnormal hemoglobin, that can be an indicator of complications. I'm told 30% or higher is leaning toward the likelihood of symptomology. But again, who knows?
We don't. Absolutely. I've thought about that. I wonder how much sickled cells I have floating in my body. Certainly not as much as my son, but there are tests. They're not likely covered by insurance, but I would like to know, and that should be an option. We should have discussions about until it is covered by insurance. They don't know which of us who would like to pay out of pocket. If we would like to better understand, then we should be given that opportunity.
Right.
So I'm so grateful for the fact that you come on to our show. This is the second time you've come on, and it still will not be the last.
It will not.
This month was perfect with it being Kidney Health Awareness Month. Also very appropriate with Ronnie Hillman. I was very much aware of his passing, and it was very, very quick. And so his family is still living with that loss, as are other families who have dealt with a loss and wrapping their head around something that they had been told wouldn't make a difference in their life. Actually did. And so we'll continue. I ask those who are attending our show tonight, make sure that you're talking about sickle cell trait. We got to raise the conversation. We got to make the conversation normal, so that people will get excited about learning more. And that it will be funded appropriately. Because I tell people all the time, no data, no dollars, no research, research, no cure. But you can't get to the data without some of the research. And so it's a vicious cycle, but we have to address it head on. There are solutions because we've seen it in other conditions. And so as long as there are solutions, the array has a voice. And even if they don't know the solution, we're going to find one. We're going to build a table. We're going to build a door. We're going to walk through it. We're going to sit at it until we are heard. So
yes, we are.
I know me. These are the things that are important to our livelihood and our quality of life. It's not just quantity of life, it's quality of life. And so thank you, everyone. I do want to make sure that I say, I go through our last slide so that I can say a technical thank you. I know it's loading and should be up in a moment. There we go.
I see it.
Yes. So once again, we want to thank Dr. Tomia Austin with the As One Foundation. I invite you all to follow her on Instagram, Twitter, and Facebook under As One. I believe you're on LinkedIn as well.
Yes.
And so stay up to date with what's happening and new understandings, new research. You do a great job of posting that as well. And then, as you all know, we have SickleSMART virtual education year round. We invite you to be part of it. If you'd like to learn more about it, you can go to our website. We also have a YouTube channel that we upload all of our previous sessions to. So in a day or two, you will see this session up on our YouTube channel as well. And you can sign up for all of our virtual education events at Eventbrite. And if you have not followed us through Eventbrite, we invite you to do so that you can be informed. Also, when you're on the YouTube channel, be sure to click that little bell so you can be informed when we have a new video that is released. That's about our YouTube channel. I got ahead of myself, but yes, you can view previous sessions on demand, sickle cell education when you need it the most. And then we have some other virtual activities coming up, and we have our community-wide support and empowerment group that is open to the entire community, no matter where you live, what state, what country, it does not matter. We want to make sure that people find a place that they can call home and be able to safely talk. We are beginning our series, Ask Dr. Nelson. It is community-led conversations about navigating the healthcare system while caring for someone with sickle cell disease. And it is with myself and a sickle cell expert, physician expert.
Awesome.
And he is not afraid to say the hard stuff and approach and talk about the disparities, talk about health inequities. And that's the reason that he is our medical director, because he is unapologetically bold in the way he talks about it. And then I'm looking forward to April. In April, we will start our More Than Sickle Cell. Yes, we talk a lot about sickle cell because we're a patient advocacy organization, but you are made up of more than your sickle cells. And we want you to have conversations so that you can have holistic good health. And so we want mind, body, and spirit. And so we're going to be having lots of different conversations. Yes, it'll include sickle cell, but it'll go well beyond sickle cell about our wellness, our community wellness. So we invite you to attend. And then, as always, we are, I saw a commercial yesterday here in Minnesota about the shortage of blood. Anytime there's a shortage of anything, guess who gets even shorter? The shorter end of the stick. Yes, any communities that are underserved, disadvantaged, that suffer marginalization and disparities, it's always going to be worse. It's no different with blood and bone marrow. So please, 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 our blood, when I say our, if it's for us, it needs to be by us. We the us, y'all. We the us. We got to show up.
Yes.
Okay. And so we encourage you to donate. Also be the match. There is a cure for sickle cell disease. It is not the right thing for everyone, but it does matter for some. But it would matter for even more if there were more of us on the registry, because those close matches do matter. So we encourage you to learn more about Be the Match by going to their website and joining the registry. And then last but not least, our voices do matter. That's really what we're here for, is to make sure that we are elevating our voices, that we are saying what we need to say in a way that we are heard. So we have here at Sickle Cell Foundation of Minnesota created a way for you to share with us your experiences in the healthcare setting, not just the negative ones, but also the positive ones. We want to make sure that when we are sitting at tables of influence, we can talk about what's going well and what's not going well. We don't use names, but we want absolute examples of what's happening behind the walls of healthcare. And we only get that with you sharing your voice and you understanding the value of your voice and your story. So you can go to our bit.ly at Our Voices Matter Too. All right. And then we hope that you will join us for our next SickleSMART event. Again, we thank our sponsors and our supporters, our guest speaker, As One Foundation, Beam Therapeutics, Memorial Blood Centers, and the Sickle Cell Disease Data Collection Program here in Minnesota. Once again, it's a pleasure having you in our house, and you are always invited back. Keep an eye out for all of the different things we have coming up next. Check out our calendar page on our website, and we'll see you next time. Have a good night. Tomia,
good night, everybody. I'm sorry.
Will you stay on for just a moment?
Sure, absolutely.
Thank you.